So just a few background ideas about herbal approaches to treating panic disorder and emotional turmoil. One comment that comes up again and again in the context of roundtables with clinicians is how little us human beings really receive to moderate our emotions. It seems like it should be a core human discipline that we are taught from childhood and toddlerhood and preschool to temper our emotions, to walk away from frustrations, to be able to self-soothe. So given how common mental health issues are, it is surprising how little tutelage we actually receive in our emotional resilience. I also just want to mention the diagnostic categories of panic, anxiety are really on a continuum and overlapping. But if you practice in the manner that forces you to fill out insurance codes, usually you have to pick one or the other. You can choose them both, depression and anxiety, or panic disorder, PAD, panic disorder, or general GAD, generalized anxiety disorder. But when we work with patients, we can often put a much more finely tuned description of what they're suffering from. We would want to offer gentle nerve tropho-restoratives, things like oats and chamomile. We would want to make sure there's not leaky gut or some kind of crude inflammatory disorder going on. We would want to give nutritional supplements to some cases, especially people who have a poor diet or we think they have a digestive disorder that causes them to not absorb nutrients well. Essential fatty acids are very valuable for neuronal repair and regeneration, as well as are useful for anti-allergies when there's some kind of inflammatory process going on in the brain. Vitamin D, B vitamins. When depression and anxiety begin following a stroke or in old age, kind of slow, insidious onset for a person not previously prone to anxiety states or panic disorder. So let's take a look at a few other formulas. Panic disorder is certainly on the same continuum as anxiety, and so a formula for panic disorder might not be terribly different than a formula for anxiety, but we might want to put in the big gun herbs temporarily, those herbs that work quickly to kind of calm down severe stress, severe anxiety states, severe adrenaline surges or sympathetic nervous system, epinephrine disorders. A person can hyperventilate and feel faint. Their vision might tunnel down when they're having a severe panic attack. We're going to take a look at some of these plants and look at their specific indications. The following materia medica options can be used for a wide variety of complaints, and I'm going to focus more on the specific niche indications for panic disorder. Catnip, I love that little photo. Nepoticateria or catnip is used traditionally and emphasized in many old books for children, cranky babies, toddlers with irritability, kids who are overstimulated, or kids who are irritable because they simply have a cold or a tummy ache. It's known to have antiviral effects, but don't overlook Nepeta.